Hi, good afternoon, everybody. Welcome to COVID-19, Implications for Science, Technology, and International Affairs. I am Joanna Lewis, and I'm the director of the STIA program and a professor here in the School of Foreign Service. As we wrap up this very untraditional semester here at Georgetown, the STIA faculty, staff, and I thought it would be really nice to hold an end of the year event to bring together the STIA community and beyond to really reflect on the historic period that we are all living through and the broader implications that we are seeing for issues across science, technology, and international affairs, from earth and space science to energy innovation. We also will hear from two of our world-class global health experts here in STIA and learn about how COVID-19 is affecting vulnerable populations around the world, where many of us work, and we'll hear about how new data science techniques are helping in the humanitarian response. Today's event will be a panel discussion, and we have 5 excellent panelists I'd like to briefly introduce to you all, and you can see them here. First, we will hear from Rebecca Katz, who is a professor in the Science, Technology, and International Affairs program, and she's the director of the Center for Global Health Science and Security at the Georgetown Medical School, and she'll start us off talking about the global response to COVID-19. We will then hear from Professor Sarah Johnson. Sarah is an assistant professor of planetary science in the Science, Technology, and International Affairs program and the biology department here at Georgetown. And she's going to speak about COVID-19 from the perspective of Earth and space science. We will then hear from Rajesh Veeragathanan, sorry, Raj, assistant professor of Science, Technology, and International Affairs, on using socio-spatial data to promote a more equitable response to COVID-19, particularly focusing on some of the work he's currently running now in India. And then we'll turn to Professor Emily Mendenhall. Emily is the Provost Distinguished Associate Professor of Global Health here in the STIA program, who's going to speak about the complexities of COVID-19 inequalities from cells to society. And finally, we're very happy to have Addison Stark joining us. Addison is an adjunct professor here in the STIA program, and he's also the Associate Director for Energy Innovation at the Bipartisan Policy Center, who's going to speak about the impact of COVID-19 on the US innovation ecosystem. And after we hear from all of the panelists, I will moderate a question and answer session from the audience. And so look forward to hearing your questions then. And so with that, I'd like to go ahead and turn it over to Professor Katz, who's going to kick us off this afternoon.
All right. Hi, everybody. So let me start off by saying, and I think this has been a surreal time for everybody, but including myself. And this is, I've spent the last 20 years plus thinking about how we prevent, detect, and respond to public health emergencies, including pandemics. I should say, global health security experts have long been worried about the emergence of a novel respiratory virus, and we've all kind of watched in horror as this disease has become a pandemic, overwhelming capable and low-resource nations alike. The pandemic highlights the importance as well as the limitations of global governance of infectious diseases. It showcases the importance of ground truthing the functionality of domestic preparedness levels. And it also demonstrates the critical need for early, capable, and strong national and global leadership to coordinate effective response and contain the outbreak and to save lives. For those of you who've had me in a class, you've probably heard me say this, but basically every plan we've had in place, every international agreement we painstakingly fought over, every system that we've all worked on for multiple decades has basically collapsed or become ineffective in some ways that are predictable, and we kind of knew that might happen in a pandemic, and in some ways that were not, and really, I think, eat at many of us and try us every day, and all the work that had gone into creating really what we thought were really robust pandemic plans in some ways have been completely ignored. So I think establishing strong leadership and coordination to beat COVID-19 globally and reestablishing national level capacity for pandemic response and global health security, in theory, will ensure that the world is better prepared to fight future outbreaks and pandemics as well as the one today. Doing so, though, requires a wholesale change in the way the US and the world fights infectious diseases. And there are significant prospects for smart investments that will not only save lives in a pandemic, but also improve public health, global development, national and international security today. I think it's important to note that global health security has been underfunded significantly, certainly in comparison to other national security threats. And this pandemic is shining light on the consequences of that underinvestment and the lack of prioritization. It's also showing that even though we've had a dialogue around this for a long time, health security has never truly become an integral part of national security and foreign policy. But I think clearly it needs to. I think first, domestic and global health security need a major infusion of sustained resources. We need a renewed commitment to leadership in global health security. We need to truly elevate health security as a national security issue, which is going to require that countries fundamentally change the way they approach health security challenges. And finally, we no longer have to capture the imagination of anyone right now. I mean, I've spent decades screaming from rooftops to try to and designing all sorts of insane scenarios to try to convince people that this was something people should care about. And we didn't get very far, because in the conversations, the very best thing that you could say would happen is nothing. And that's been it's been a challenge. It's been a challenge with finance ministers. It's been a challenge in prioritization. It's been a challenge in the national security environment. But clearly, COVID has changed that conversation. So we're not speaking in hypotheticals anymore, but people are dying and economies are suffering. So we really need to do a couple of things. We need to change a couple of things. And I've been told, not a couple of things, a lot of things. And first, I've been told by many folks, oh, you don't have to worry about funding anymore. All this stuff that you've been yelling about for years, it's all good. You'll be funded the rest of your life. You're going to create systems. It'll be great. But the challenge that we have is that in this field, we do suffer from what we call the cycle of panic to neglect. And I think I think there'll be no doubt we'll be in the panic phase for a long time, but I really do wonder how long it will last until we slide back into neglect. And because of that, I think there is a chance to try to create the systems that are required right now and to build functionality before we slide back into that neglect cycle. So I've been creating a list of things I think we could possibly do, should do. That list seems to grow every single day, but I thought what I would do right now is just list a couple of them and then pass it over to my esteemed colleagues to get into some details and different parts of how this outbreak is affecting different aspects of the STIA community. But first, again, if I was going to pick a few things, I think this is an opportunity to really re-examine global governance of disease. We need to be thinking about global health diplomacy. There's a diplomatic window where we need to build upon the existing partnerships, whether this is G7, the WEOG, the Australia Group, the Global Health Security Initiative, to really seize the initiative and both set the tone and the pace of diplomatic discourse to coordinate the next stage of the response. We need to take a good hard look at the international legal regimes that we do have in place. I would prefer we don't scrape them, but scrap them together, but instead really think about how we revise the international health regulations. How do we make it more fit for purpose? It's the same way I feel about the WHO. There's a lot of proposals for doing things like, let's get rid of the WHO or create a different WHO. And the same thing for CDC. I think we're much better served by thinking about how do we actually strengthen the institutions we have in a real and resourced way. How do we ensure stronger systems are in place for information sharing, including pathogen sharing and genetic sequence data? How do we think about what our national manufacturing and supply chain should look like, with the assumption that countries will nationalize during times of crises, and how do we plan accordingly? How do we support subnational entities, since that's where decision-making often happens, and whether that is to build upon networks of mayors that we have been working on prior to this event, or what kind of guidance looks like to actually support where the decision-making, where it actually happens and where vulnerable populations are protected. And then we really need to figure out how to codify the relationship between the public and private sector in health security. And there's some really interesting, fascinating innovation that's happening, but we don't have a way to actually capture that long term. So how do we think about that? At the same time, we also think about resources for PPE and coordination for contact tracing, and when we get to the point of actually having a vaccine, inshallah, that there's a system in place that's coordinated for prioritization, manufacturing, prioritization, and distribution, none of which is actually in place at the moment. So I really think we need to be rethinking our global health system, and thinking about how we not only build these capacities, but also build long-term sustainable capacity in our partner countries, so we can maybe get away from this parachuting in mentality and instead really think about what partnerships look like. And all of this will require resources, and it's going to require partner countries themselves to prioritize health security and put a bit of skin in the game. We have empirical data to support the anecdotal evidence that we've been collecting for years about how investments in public health infrastructure actually mean very little if they don't lead to long-term capacity unless the partner countries themselves buy into that process and chip in financially. So again, a lot of things that I'm just throwing on the table, but I think there's we've got a lot of problems we need to solve really quickly. And there's a lot of things we have to be thinking about in terms of response right now, as the same time that we start to think about the systems and the processes and the resources that are going to be required to not just respond and recover from this pandemic, but to fight the next one. So with that, let me stop and then turn over to folks who will give much more specific.
Thank you so much. And really, Rebecca, thank you for all the work you're doing to try to get good information into the hands of policymakers on this difficult topic. You know, I had the pleasure of co-teaching our Gateway course with Professor Katz right before spring break, where she led a unit on biosecurity and was teaching everyone about the institutional limitations to a global outbreak response. And it was amazing to hear about this in the classroom and then actually live it in the following weeks. So it was just extremely timely, and your comments were very, very prescient, unfortunately. And with that, I'd like to go ahead and turn it over to our second speaker, who's going to shift gears a little bit, Professor Sarah Johnson.
All right. Let's see. Can you hear me? Okay, this looks like it's gonna work. So thank you so much. Thank you so much. I really just to Rebecca. I mean, we are so fortunately here in STIA to have Rebecca not only at the helm of a lot of decisions that are happening at the university level, protecting our community and figuring out how we're going to adapt, but also just being part of these national conversations, and Emily Mendenhall as well. I've just never felt so proud of my colleagues. It's been really incredible. Anyway, as Joanna said, I'm a planetary scientist, and so I thought I'd just share a couple things that, you know, the Earth and space science communities have been thinking about in response to COVID. I'll just start. Oh, yes, here we are. So one thing that, you know, like a lot of workers at federal agencies, most NASA employees are working from home. We're doing mission critical operations are continuing. So I'm on the science team for the Curiosity rover, and so we're doing all of those operations remotely. There's a great article that NASA just put out about how the scientists and the engineers are coming together in their apartments and in their houses, you know, trying to coordinate to keep mission operations going. We've got, you know, astronauts still launching to the International Space Station. We've got some really exciting things coming up in terms of the first time that human spaceflight is going to be going from the US soil for almost a decade, since 2011. That'll be next month on a launch with SpaceX. some of these things are still going on, but it's mainly the mission critical operations. And there are a lot of folks at different NASA agencies that have been able to take some of their time and energy and devote it to the COVID response. And so I just thought I'd highlight a couple of those things. On the left here is this tremendous team of engineers from JPL that, capitalizing on the success that they've had in rapid testing and rapid prototyping and just really excellent engineering, have come up with this ventilator design in just 37 days. And it's really primarily set for field hospitals, which, we're hoping that we're going to stay below that hospital resource level. But it's really exciting to see that, if we do end up with large scale field hospitals at some point, as we continue to fight this pandemic, we've got these wonderful, brilliant engineers that are coming up with great responses. NASA also has some tremendous supercomputing power, and there are lots of questions that we're coming up with that, would take weeks or months to do on more traditional computing and servers, but NASA has these great supercomputers. So when we think about these epidemiological models or these bioinformatics or the molecular modeling that we need to do to really fight this virus and come up with a vaccine, we've got NASA putting in there. But I think what I really wanted to focus the rest of this little talk on is what we can do just from seeing Earth from space, and how we can track what's going on and how we can start thinking about our response. And we just have these tremendous satellite resources. Earth observations, in some ways, I feel like have never been so important. We've got dozens of satellites, both from the US and from other countries and other consortia and private sector folks that are doing Earth observation. Everything from high resolution imagery to, looking out in other parts of the spectrum beyond visible light to make these calls about what's going on with land use, what's going on with populations and shifts. And I just thought I'd show a few images. So this is from a private company. It does high resolution imagery, but this is Mecca, the Great Mosque. And you can just see on the left is after the pandemic broke out, and on the right is before. And you see these real changes in human movement, and we're seeing these across the globe in these high resolution satellite images. We can also see lots of things about the global response. So here's one of the field hospitals in Wuhan that got constructed in a matter of days. And you can see on the left before, just empty fields. And then on the right, this massive new construction effort. We can also do a lot with energy use. And so this is an instrument, a visual imaging radiometer that's on a satellite that NASA is looking here down at Wuhan, and this is looking at light emission and reflectance. And you can just see that as the quarantine goes into place, the dimming of lights throughout the city. And it's really interesting to think about how energy use is changing, because it's having really tremendous impacts on environmental quality. And so, lots of pollutants to think about. One of these is shown here. This is nitrogen dioxide, which is a common pollutant. It comes from car engines. It comes from industrial processes. And so just in the span of a couple of weeks here in China, you can see these very large emissions of nitrogen dioxide just dropping just to next to nothing. And it's not just nitrogen dioxide, we also have carbon dioxide emissions dropping really dramatically. In China, we already think it's a 25% reduction, a temporary reduction, to start, but we don't know sort of how long the virus will go on, and projections are looking like we will have the largest drop in carbon dioxide emissions since World War II as the result of this pandemic. And it's like we're inadvertently running the largest scale experiment we could possibly run, trying to figure out, what would happen if we did, in fact, successfully succeed into transitioning to a low carbon economy. And of course, this is not the way we want to do it with millions of people out of work, but I think there's a lot of hope among the environmental community that if some of these stimulus packages can be kind of green stimulus plans, we might be able to lock in some of those reductions. And, we may see other changes. Say if meat becomes more difficult to access, maybe there'll be more of a shift to different types of relationships with food and more vegetarian diets. It's really interesting to sort of think about what might happen sort of in this sphere. But one thing I think is also really important is using these kinds of Earth observations to think about the supply chain and like what's going on with transportation. For instance, here's a train station, and you can see no more trains after the pandemic shuts down. But monitoring what's happening, upstream, and are factories closing at a large scale? Are people starting to move around, or are they not? These are really interesting changes. As well as just tracking the domestic and the international food supply. And I think there's a lot of concern now that there may be widespread famine or hunger and as a result of, just being able to get products to market. And so, we've got these Landsat satellites, which do an excellent job of monitoring land use, and they help policymakers, and they help us understand how resources can be utilized and what's going on here. So I'm really hopeful that we'll be able to coalesce some of this information from this extraordinary constellation of satellites that we have in orbit to help us understand, these very large scale movements that are happening in response to the pandemic. But I think I will leave it there, and I'd be happy to answer questions at the end if folks have questions.
Great, thank you so much, Sarah. It's so interesting to see just the amazing global scale of the changes that are happening, and just how quickly we've been able to witness this. All right, I'd like to go ahead and turn it over to Professor, to Raj, sorry. Raj is going to talk about a really interesting project he's working on in India, where they're in real time have been able to convert their actual data to actually help the humanitarian response. Raj, go ahead.
Thanks, Jonna, for the opportunity to talk, and for those of you who've taken the time to attend. The COVID tragedy affects us all, but I want to make the case that I probably don't need to make the case, but it's very obvious that what we're finding globally is that it affects the poor and the marginalized citizens the most. So I'm going to talk about one of my research projects that started before COVID, 3-4 years ago, and how we had to react to COVID, and in some sense, it's an opportunity for us to be in a position to do something about it, and particularly for the poor and the marginalized. And in talking about what Sarah talked about in terms of using some of the satellite imagery, if you will, to render visible the poor, which often are left out of imaginations of even state governments. And so I'll talk a little bit about how what we are doing there. This was before COVID, and how we are adjusting to what COVID, the crisis of COVID. So there's something called slums, or unplanned settlements, that many of you probably have seen a movie, at least in India, called Slumdog Millionaire, where you have most of the poor live in extremely bleak conditions. And I do ethnography, or I do part of ethnography, and also do quantitative work. And I've spent a lot of time living in rural areas, and never felt any kind of misgiving about how some of the very, very poor and rural situations live. But when I started doing this work the last couple of years in cities, where in slums and what is officially kind of called as unplanned settlements, it's mind-blowing. And I look at all guidelines that after COVID gives us, right, in terms of 6 feet separation, washing soap, use clean water, and avoid contacts. And it's just, anybody who's kind of visited a slum or an informal settlement, an unplanned settlement, you can immediately realize that how impossible that any of these guidelines do not apply to most people who live in these horrible conditions. So what what I want to do is to show that this is going to be a kind of a description of a project that we are doing, and in Delhi, where more than 2/3 of Delhi's population live in these settlements, right? In fact, we don't even know, we don't even have a sense of how many people live in these settlements. Even governments, as I said, do not have reliable data, as many of these services are provided by different local governments. And Delhi is not unique. Many of the cities of the global south, and practically more and more places in the US are running into this issue, where with massive urbanization of many parts of the world, where rural citizens are moving to the cities for work, governments have been struggling to cope with even providing very, very basic things. And if you look at the statistical record, most of these things are not even documented. So what we know from prior work is that there are cities within Delhi. So there is no one place called City of Delhi. The cities of Delhi, with people hacking access to public services like water, sanitation, schools, ration shops, and transport. And there's a study which shows there are 9 different cities within Delhi that has been existing. So it's not, these settlements are not transitory, but are firmly part of the urban condition. So the past 3 years, what we've been doing, in some sense what Sarah talked about, where we've been trying to kind of first understand, can we use satellite imagery to even locate these settlements, these slums? And what we've been collecting is we've done 3 things. Our work addressed 3 critical challenges of data collection. One was using the satellite imagery to kind of try and map the boundaries of settlements. Number 2, to actually geocode very basic things like ration shops, where hospitals are there, where the access to transport is there. And we have this urban spatial observatory, a website, which where we collected a bunch of this data. And what happened was, I'm slightly troubled by this. When the crisis happened in the 24th March, the Indian Prime Minister Narendra Modi announced a countrywide lockdown to control the coronavirus epidemic. And this, it was an opportunity for us in some sense, because we realized that we are the only people who actually have data of where very basic things like ration shops and government do not have it. So we had geocoded where all these places were, and so we put it up immediately on a Twitter feed and opened up this data set, and we were extremely thankful that our data was used by the government to locate these schools and ration places to provide hunger relief centers and night shelters for people. And we had mapped initially 427 of them. And within a few days, we found that around 300,000 views of our map. This led to the government realizing that this is a type of data that we need to collect. And now we are, I won't go into the details of where we are, but just to show that now we're getting requests from other parts of India. We're getting requests from Mumbai and Chennai, from civil society, from state governments, to basically kind of recognize that the importance of actually having very, very basic things about a city, about the right to live for the poor. And now things like satellite imagery, things like geospatial data, things like allowing these maps, not just to be a nice academic project residing in a paper, embedded in a paper somewhere, but actually trying to make it actionable for people and governments to take action on. So if you want to be part of this project, I know a bunch of students on this call, check out urbanspatialobservatory.org. If you're interested in working with us on this project, please write to me at, you can find my email ID on the website. And if you want to take this work to a different city, and if you have access and you're passionate about a particular city, please write to me as well. We really think that we're trying to use this opportunity that this crisis has given us to see whether we could render legible the poor who live in the cities, who are often I mean, I wanted to show some of the images, but I just couldn't get myself to do it, because you see all these people migrate, walking miles back from these urban areas back to the villages. And if you want to be part of an effort to kind of do something about it, please write to me. Thank you.
Thank you so much. And if you want to read more about Raja's really interesting project, we have a story up on the main page of the STIA website. So you can check that out at stia.georgetown.edu. I'd like to go ahead and turn it over to Professor Mendenhall. Go ahead.
Okay. Trying to share my screen, but this isn't, oh God, just a minute. Is it not happening? Oh, just. It's shut down. Okay, here we are. Hey everyone, it's such a wonderful opportunity to have this time to talk to you a little bit about the complexities that we're facing. As you all know, I'm an anthropologist, so I'd like to talk about some of the squishier social things and my colleagues, so I'm going to talk about those today. I published a short piece thinking about how we conceptualize COVID-19 coronavirus as a syndemic very early on, because actually the SARS 2003 outbreak demonstrated that people with heart disease or cardiometabolic conditions were more likely to die in Hong Kong and elsewhere due to this respiratory infection. And so there was already some evidence that there were some syndemic qualities biologically, because we know social, political, economic factors really shape how we think about who gets sick and who doesn't. So from the get-go, I was already thinking, because of what we'd read from previous epidemics, about why this was syndemic. And some real challenges have come to the forefront that are politically driven, socially driven, and economically shaped, that we need to talk about when we think about what COVID-19 really means in the lives of families and communities. So overall, when we think about coronavirus, we have to think about it from this social as well as this viral perspective. I mean, you could not know that any more than anyone else as you are living this. And these social ramifications are realized in such deep ways in your everyday lives. But we all know what this is, but what does it really mean? So as I go through in this article, I talk a little bit about what living in dense context really matters. So in the US and elsewhere, we have these complicated challenges of overcrowding in prisons and the risk that poses to especially elderly prisoners, and also our detainment centers, and what our immigration policy has done to drive risk and to affect those who are more likely and more vulnerable for infection, and really thinking about what that means in the lives of some people and not others in the United States, especially thinking about racial, economic lines. This is a real tragedy and inequity that we have to understand. And also we have to think about the densities in which people live, what neighborhoods live, how dense neighborhoods are organized, what that kind of risk with social distancing can mean for some who have big backyards or maybe live in rural areas compared to others who maybe live in closer contexts. And then really, we need to think a lot more about what it means, what risk means. The concept of risk is not just about infection, but as we're kind of tracking the epidemic and as people are in quarantine longer and longer, we're seeing that domestic violence is a huge challenge. And those people who feel unsafe potentially every day have greater risks due to confinement and the lack of resources available to support people, children, mothers, families, other family members who may be really dealing with feeling unsafe and now have pretty extraordinary risk due to this social confinement. So when we think about security, we have to think about pandemic preparedness. We have to think about what health security means, but this security is so deep. It's financial, it's emotional security. In the United States, we have this extraordinary situation where people can go bankrupt due to medical expenses. Whenever I talk about that around the world, people are so astonished that our health system is broken and we do not care for those who need health care. And I think I often say this to my students, but it's something we need to remember again and again, that that health should be put, people should be put over profits, and health is a social good. But in the United States, it's a commodity. And this plays a very, very powerful role in how people are responding to COVID. And I can circulate some of these really interesting responses through GoFundMe campaigns, which GoFundMe is a way in which a lot of people pay for medical expenses. And we've seen an uptick in these cases to care for family members who have outstanding medical bills due to COVID. And this is a really big challenge in how we structure our healthcare and how we care for those, especially most vulnerable. And this is bringing these challenges to the forefront. So also, when we think about security, we think about loss of jobs. So many in our society are now unemployed, facing mortgages, facing rent, facing food insecurity. But also loss of loved ones, feeling emotionally secure to kind of move on. Also loss of childcare or elderly care, in-home care. And this breakdown of the social fabric creates really new challenges, and we are forever changed. And I think there will be incredible innovation and incredible new social challenges, and also transformations from this epidemic, which are yet to be seen in our lives, in our community members' lives, in our nation's lives, but also globally. And it's really important to think about, our failure in the United States to this response is a political one. The US response reveals this political failure, but not a scientific one necessarily. As Professor Katz said earlier, we've had the science and policies in place, but they were not implemented appropriately. For instance, we still do not have comprehensive testing, contact tracing, isolation of cases. These failures will significantly delay and weaken our ability to safely reopen anytime soon. And although, of course, some states are attempting to do so, this creates risk for so many people. And we will see state by state what these political failures or political successes, different responses will do. It's a natural laboratory for thinking about politics and healthcare. And we know politics and health are so tightly wound together. Political leadership matters so much. So I wanted to talk about President Ramaphosa's response because it's controversial, but it also is very different and provides a different type of leadership. So I've worked in South Africa for nearly a decade, and I follow health and politics there pretty closely. And I also understand and study how poverty makes you sick and what that means in the context of the United States, in the context of South Africa. I've also worked in Kenya and India and Zambia, and this all informs how we think about this. But it's been really interesting to watch the South African response, which is so different from the United States. And, so quickly quarantine was enforced and implemented. It was expansive. They don't even allow people to actually walk outside. It's strictly enforced. The police is out in full force. And so what quarantine means is a national strategy. It's a lockdown compared to what we've seen nationally, which is really no strategy, leaving all autonomy to the states, which has been really interesting. Someone said it's kind of like being in a swimming pool where you may, clear off one part of a pool, but everything's kind of connected. In South Africa, that's not what's happening. They've actually closed it down pretty quickly. And but enforcement has not been safe for everyone. So people residing in townships like where I work have very different challenges than compared to those in wealthier ones. And these are racial and economic factors that are real and historically deep and have created really different realities. I have working with a cohort that I've developed and interviewed almost 1,000 people in Soweto, in the township, one of the biggest townships in Johannesburg. And we found that many people are struggling in a very deep way. They described stress. One actually man we interviewed last week said he was really stressed out because his neighbor's shack was destroyed by the police because he didn't have land rights to the land, and his family was displaced in the middle of a national lockdown. Now, this isn't uncommon to approach families and homes in this way, but in the middle of a national lockdown, where are they supposed to go? And these cases have been reported again and again and again, and so people are starting to talk about these human rights abuses amidst the lockdown, and this brings brings forward these really big challenges. Okay, what does a national lockdown mean? How do you enforce it without abusing human rights, without putting families and children at risk for displacement? So there's risk of the virus, but there's also risk of fear, of lack of food insecurity, of feeling unsafe, of having nowhere to sleep, nowhere to care for your children, nowhere to feed them. These are extraordinary challenges that we're talking about every day here in the United States because these are real here, but they're also real elsewhere. And there are trade-offs countries are making about keeping people safe, as well as saving or keeping people safe broadly from the virus, as well as in people's homes and in their personal lives. So it's important to think about this, and I've written about this generally, but in the US and South Africa, we share these deeply situated racial, economic, and health inequities. These are coming in sharp focus with COVID-19, as epidemics or acute viruses often do, where heightened risk of moderate to severe COVID-19 is heightened among risk factors and conditions that are disproportionately afflicted by low and middle income families, and especially in the lowest income neighborhoods. I write in my new book, Rethinking Diabetes, that when we think about the transition, when we think about emerging economies, when we think about how diabetes and stroke and heart disease transitioned within wealthy nations, emerging economies, low income nations now, initially they affected wealthier groups and they slowly transitioned to affect low income groups. And what I study actually in South Africa, this big study on how infectious and non-communicable diseases cluster among certain people and what this means, and how stress and violence and different types of financial insecurity promote the or increase risk of some conditions, including diabetes, which is what I look at very closely. And I fear this is something we're going to see. So currently there are no cases in Soweto, and if they achieve the lockdown, this will be fantastic. But what we've seen in the United States, and what's pretty well documented, and they have extraordinary data on this, is especially traditional African American communities are disproportionately affected by the virus. And this is this kind of racial inequalities in the United States on who is affected and affected by moderate to severe COVID is a problem of racism, of institutionalized inequalities that are then embodied in these cardiometabolic problems, which also are manifested further when people delay care seeking or maybe not provided testing because of racism in the healthcare setting. So there's a lot of complexities that come to the forefront within these extraordinary situations like the one we're in. So the last thing I wanted to just talk a little bit about is, how South Africa is doing a pretty good job nationally of staving off the coronavirus, although these are early days. And of course, there's a lot of social and political complexities that also are enabling them to have this national lockdown. So already the effects of the virus on mental health, though, in people's lives are real. From our interviews, we're calling people on the phone. My team is, and they're finding people are really feeling a lot of fear, anxiety, distress, domestic violence, and so on. And these are challenges that we're feeling in our homes in the United States as well in very different ways. So in my research, we have a cohort of 1,000 people, but we've only interviewed about 300 so far of that cohort. But we found that people understand very clearly what coronavirus is and what the risks are for infection. Although, some people have some kind of like different ideas about what the virus, where it came from and what it is. Most people generally understand. But what's most difficult in this first kind of month of lockdown is not necessarily viral, but these social consequences. So we're looking at mental health indicators from before the pandemic and now in lockdown that people are facing, and we are finding that mental strain from the social impact of the condition could not be clearer. People are much more distressed and really demonstrating distress from this quarantine. So, often in pandemics, the rest of common health conditions are also set aside. So people are stressed not only about the quarantine, about security in their homes or in their communities, but also about the ability to actually access a health system. We see this with Ebola. We see this with all types of emerging infectious diseases, which Professor Cass talks about so extensively. And what we see is that healthcare for all other conditions, or basically routine care, is really put to the side. And this is an extraordinary challenge for people who also have more risk for moderate and severe COVID, who have chronic illness, diabetes, depression, heart disease, hypertension. 1 in 3 people in Soweto, where I work, have hypertension. So actually manage these, getting access to medication and caring for their existing conditions create, some type of fear and concern for what's going to happen if they get COVID. So this is all the realities that people are facing, and our thinking about pandemics is not only about this viral spread and this medical response, which is really fundamental, and we're reading tons of articles every single day, but politics, economic security, and social relations are critical for promoting good mental health. We cannot overlook this for people around the world in quarantine, as well as within our own homes. And I just want to leave you with a reminder to find some peace wherever you can. We at STIA are all thinking about you and wishing you some calm and love during these difficult days. We care about you a lot.
Thank you so much, Emily. It's really a really nice sentiment during this really difficult time. And obviously, of course, very nice to hear the anthropological perspective, which is always, I think, really insightful. Okay, I'm going to now ask our final panelist, Dr. Addison Stark, to go ahead and wrap us up.
Great. And I do plan on sharing some slides. Oh, perfect. Cool. I was just waiting for Emily to take hers down. Let me go ahead and get mine queued up quickly. Okay, I think we're good to go. So, hi everyone. Addison Stark, and as Joanna had pointed out, my day job is not on campus with everyone. I work at a place called the Bipartisan Policy Center, think tank downtown here in DC, where we have been focusing broadly on economic and energy and health issues all across kind of the spectrum of what we would classify as topics where we can get bipartisan traction. Up until the end of February, my focus has been predominantly on finding a bipartisan pathway forward on addressing climate change. And a big part of that was always focused on innovation. Energy innovation is a place where we could identify a path to move forward on an issue, which now obviously we're in an entirely different policy environment. One thing that we recognize at the BPC is in this new COVID reality that the entire policy debate has been turned over. And so we've really started to think strategically about how we address what is truly a crisis of national and global importance. So I'm going to walk through a little bit about my identification of some of the issues that have been occurring and the impact COVID has had on the innovation ecosystem in the US, which is broader than just the energy innovation ecosystem, but has a lot of real challenges for how we're going to be addressing economic response. So many of you would recall seeing what was, actually the first week of this, when it was the first $3.2 million jobless claims that was published in the New York Times, where it was an incredible piece of infographic where the graphic was plotted below the fold on the front page, and then the single week numbers went all the way up on top of the fold, which really shows the scale of impact. And when you compare how jobs and economic impact is occurring during this crisis compared to the 2008 recession, we see that we're in a very different reality. And a lot of that stems from the fact that, or actually the vast majority of it stems from the fact that we are rightly socially distancing, and meaning that there are vast parts of the economy that are not taking place as normal. And this is not just what we've all seen a lot of that's impacting our daily lives of service economy and everything else that, where we see that there's a lot of restaurants are shut down. But this has been broad-based across the economy, impacting clean energy deployment. So we've heard that there's been a major downturn in how actually building projects, And also it's directly impacting, you know, as what we're all used to in the university and educational sphere is that all the students have gone home. So this is also directly impacting innovation. So let's start from the beginning though. However, many people have probably heard the story that during the London Plague of 1665, this has been circulating during this crisis, that Isaac Newton was actually able to get a lot done. So the rich at that time, the well-to-do, were able to socially distance. And as a young student who had left Cambridge at the time to return to his family estate, he was, of course, not truly in history, but you know, the history he created later was he was inspired by a falling apple to develop his laws of gravity, laws of motion, which led, of course, to the development of differential calculus. And also, he did foundational experiments on optics. So this was a really productive time for one, you know, historical genius. But today, science is not done by individual geniuses, but instead is done through collaboration, as of course, anyone can tell who opens up clip art of science. You know, there's lots of people who are collaborating together, both in clip art, but also in reality. When you look at most of the work that's being done with major pushing in healthcare, in big science, in fundamental physics, you have international collaborations that are happening at labs around the world, but also in classrooms and also through other places where there's a lot of intellectual and social contact, like conferences and other things like that. So today, we can't see that model anymore of social distancing leading through breakthrough innovation. We may see a bump in the number of published papers that occur because people have all taken their data and have gone home and started to write up results and submitted them. However, we're not seeing the continuation of laboratory work outside of critical research around the pandemic response. And as we all have alluded to before, and we are all living now, is universities have recognized their particular role in the spread of infectious disease, where many students come from all over to centralized locations. And this was one of the very first responses, and many universities immediately followed suit, and it's been impacting for quite some time. So what we see now is the full innovation ecosystem in the US, but also globally, is on hiatus. So if you look at universities, they're shut down. National labs like Lawrence Berkeley National Lab have limited their access to visitors and non-badged people for activities that are not related to COVID response. And that's also the case across all the national labs. Industrial research is also incredibly down. Now, GE Global Research is one example. I'm not citing from them, but I spoke to an industrial researcher from a large multinational corporation who said their research team is currently doing shifts where only 1/3 of the total team can go in, and even them are divided across every other day, and they estimate that their activity is around 10% of what it would usually be. And so industrial research has been really ground to a halt. And also another place of major innovation in the US system, startup incubators, and this is a picture of Greentown Labs, an energy incubator in the Boston area, have also had to shut down access outside of core facility usage for many of their participant companies. So there's an issue here, obviously, that as many of us know from economics, that, you know, this is going to be impacting our short and long-term economic growth. So the major impacts that we're recognizing that are occurring is we're slowing innovation, and that's going to lead to slower economic growth. And this is something that's not just going to be immediate, but could play out over a long time. So going back to traditional economic growth models, more than 50% of economic growth is directly attributable to innovation. So when we're not innovating, we run into the very real risk that this economic, essentially as we leave the crisis, we're going to have a very slow recovery. And one thing that I've seen a preprint on also is this is not impacting researchers equally. So it's also going to have a challenge on innovation within the innovation ecosystem, where those who fall into the role of primary caregiver at home are also not the ones that are actually quickly writing up these new papers and submitting them. And there's been some data out there showing that men are actually submitting more papers during this than women are. And so that could be a major issue that we see within the career development of many people within the innovation ecosystem. Also, it's impacting early career researchers quite a bit more. As one can imagine, with the downturn in the market, you can see delayed retirements, and also the potential where there could be less risk taking on behalf of funding from outside an industrial partnership, and they might want to go with partners they've had for longer, and it could be a major challenge for young PIs. So recommendations that we're thinking about right now, but obviously make sense, and what I've written up in a recent piece in Scientific American on this is we need to do a broad-based innovation stimulus on the back end of this. And one thing that I think we all need to be careful about is recognizing what stage we're in. And there's been a lot of confusion in the media about this. The recent bills that have passed, the CARES Act, we look at those as rescue bills, that we're not even yet to the economic stimulus, that we're addressing both the near-term public health crisis and economic crisis of individuals in the US by offering economic support, but this is not stimulating growth yet. This is just maintaining so we don't fall further into a hole. The next stage should be looking at stimulus, followed by long-term investment in economic recovery. So it's really going to be a three-phase thing. So, but when we get to past the public health crisis, investing in innovation, R&D across NIH, the NSF, the Department of Energy, is going to be really critical as a component of how we think about how do we strategically grow the US economy. Also, we need to think about how we invest in the burgeoning sectors, into the sectors of the future. And I was on a panel last week, which gave me some experience doing a Zoom conference like this, was the fact that clean energy up until the COVID crisis, between the downturn of 2008 until 2 months ago, was growing at twice the rate of the US GDP. So thinking about the places where we invest strategically, where we can both grow faster than how we were growing before, but also address things like our environmental challenges and climate change, is a smart move about how we think about investing in the economy and in innovation moving forward. Also, we need to think about, if we want to have a stimulative effect, is investing in later stage innovation. So beyond just broad-based early investment through NSF, NIH, and DOE, but also think about technology demonstrations and the small business innovation and research programs, which directly support startups and the building of demonstration projects, which directly lead towards technology deployment. And ultimately, deployment is the procurement of steel and cement, which leads directly to construction jobs and growth in a way that is really directed and important in a stimulatory effect. So with that, I'm going to turn it back to the whole panel, bring it back to Joanna, and I'm happy to take any more questions around these issues during the panel.
Great, thank you so much, Addison. And so now I'm really excited to have a discussion with all of our panelists and to really open it up to all of you who've been patiently listening in. Particularly, I know we have a lot of students here and others from the STIA community. So please go ahead, and this is a little different from the Zoom you might have been using in your classes. If you look down at the bottom of your screen, you'll see a Q&A prompt, and that's where we're going to ask you to please go ahead and type in your questions, and then I'll do my best to get to as many as possible and direct them to the appropriate panelist or panelists. So I'd like to start off with a question that we received from Abdulio Moronta from the STIA program, and he has a question first for Professor Vera Raghavan, and he wants to know you pointed out that communities such as some of the slums in Delhi are more susceptible to COVID-19. Are there any specific socioeconomic policies that further strain and stifle government capability at the local and national level to respond and combat COVID within India?
Yeah, thanks, Abdullah, for that question. The first response would be the states should first see its citizens, right? I mean, in seeing in the sense that of acknowledging their existence, right? Today, the reality is they are almost 60-70% of the people who are there are just there, just working and supporting jobs. And so through various different political mechanisms, they've gotten access to a toilet somewhere, a ration shop here, a health clinic, a childcare center, and there are variations across the different settlement types. In fact, the project that we are doing is to kind of try and document that, right, to show how unequal the setting is. So in some sense, the first ask is, in order to kind of deal with these crises, you're right, this fundamental socioeconomic policies need to be fixed, which basically means that there needs to be actual recognition that these people are full citizens of the country. So this is not the US problem where we have, people trying to kind of migrate from different parts of the world. Here, this is citizens, full citizens who are from rural parts, have migrated to work and living in the cities. And they don't have, they don't have access to any fundamental basic services. So I would say start there, and of course it's a big start because it's obviously it's a lot of population that exists, and so and existing. I would just say that policies to kind of the knee-jerk reaction, which is to kind of demolish slums, that doesn't help. Because the standard middle class response to these slums are eyesores, and so the default tendency is to kind of get rid of them, and that's 60-70% of the population can't be gotten rid of, and so they have to be acknowledged and provided. So you need to build schools. You need to kind of make sure that the roads, you can have emergency vehicles, and if you have and this is not just this is the one thing that I'm hopeful is, if any, in this bleak, angry situation that you could see my emotions flowing, is that there's more recognition, because the reality is that this doesn't affect only the people who live in these settlements. It affects us all, especially in a pandemic. It is more apparent that it actually affects the middle class and the rich who live very, very close by. And if you just count the number of articles that has come out, and when we started looking at this urban settlement project, it was a very academic project. Now, with all the attention and the requests and the people wanting to work, I just realized that this is actually, selfishness is useful. People are realizing that, oh, it actually is going to affect me, and we need to figure this out. So that's I'll end there.
Great, thank you. Following on that, there's a second part to the question, which asks about the role of clean water. A lot of you mentioned the issue, particularly in the developing world, but not just in the developing world, also in poorer communities within the United States. Native American communities, for example, don't have access to clean water, and as was mentioned, something as simple as washing your hands becomes extremely challenging. And if this is sort of the number one way we can be combating the spread of the virus, do any of you have specific recommendations about things we can be doing, particularly to address the water issue at this time?
I can tell you what we are doing, and then it doesn't actually answer the question directly, but because we're not in a place of power. So what we are trying to do, we're academics. So what we're trying to do is to first collect data. Who has water? What is the schedule? How does it differ across the city? And then first put it out there, and that's not there. We don't have data, and we are trying to kind of put it spatially so we can actually get a clear sense. That's the urban spatial observatory, right? You can get a clear sense of who's got water. So then we can actually fight about or deliberate about or discuss about very useful things about inequality, because right now it's all like anecdotes. Nobody knows. And so the work that I'm doing, we're doing is to kind of first locate that on a map, so we can actually collect data about access to water and who's got tanker water, who doesn't have that, and all different combinations of that. That's what I'm doing at this point.
I just want to make a comment on when we think about water and we think about all of these structural issues, it's really important to also think about distribution and these kind of softer aspects of what having safe water means. And there's a lot of shame and shaming involved in access to water, using safe water, identifying some populations as dirty or vectors, or certain types of really, really often racist and not helpful things. So it's really important to think about how we talk about some of these really major access issues and are really thoughtful and supportive of the complexities that people face, because it's not just structural, it's very much social and intimately emotional, and important to think about that.
Great, thank you. I want to kind of continue on this theme and shift from water to food. There's a question from Nathan Bergen, particularly asking of Professor Johnson and Professor Veeraraghavan, who both mentioned the use of remote sensing technology for a variety of issues, but in particular for tracking the global supply chain for food. Are there ways you think we could maybe use this technology to prevent farmers from destroying crops that are high demand in urban areas, to essentially readjust the way that we're distributing food around the world? Professor Johnson?
Oh, Nathan, that's such a good question. And I think that one of the things I am most worried for the world right now is about food. I think the UN used the word biblical proportions when they were talking about the kinds of famines that we might potentially see. Like, more people may in the end die from not having food, from the virus itself. And I think that that is something heart-stopping and something that we all need to be thinking about. And I mean, part of the disruption is, right, we've had these supply chains that are all, funneling into these wholesale distributors. So we are thinking about schools and workplaces in these industrial ways that we feed our population, but without kids going to school, I think they're dumping millions of gallons of milk every day. We've got these big pallets of food, the kinds of ways that food is packaged that you could not get these massive bags full of milk, to serve yourself. And I mean, I think that there's a lot that can be done. Like, some of it is on us and our consumer preferences, and realizing maybe we don't get the food in exactly the perfectly packaged little way that we're used to, and being more flexible there. I think we need to think hard about donations and exports. A lot of trade is on hold right now. And so if there are ways that we can open up, ways to transport food. But I think that, again, the real question, I guess, was about remote sensing. And I think that there's a lot to be done, because we are restructuring fundamentally where we are sending food and how we are sending it there. And I think understanding where the foods are, and like where the fields are fallow and where things are lining up, and where ports have waiting times that are excessive and which ports don't, being able to use remote sensing for data like that. And the thing that's hard about it is we do hope and expect it to be a transient change. It's the reason that when we manufactured toilet paper, we're all gonna have trouble getting toilet paper, right? Because it's all, was in it for schools and businesses and on these big pallets, and it doesn't make sense to change that fundamentally for these countries when we're only talking about a year or two at most in terms of redoing all of their factories. But I think that some real creative thinking needs to come in here. And I think that this is exactly what STIA graduates are so good at. And so trying to figure out how we can, take the data at hand and help find these short-term changes to these supply networks, I think is going to be really important.
One of the things that I would add there as a follow-on to Sarah is there's not a built-in flexibility in the logistical chains that we thought there could have been. And we've seen innovation across logistics in companies like Amazon and their ability to adapt, but no one can turn on a dime in a month. And we're learning kind of the edge case of how how efficient and how resilient our logistics chains can be. Sensing, I think, should also be thought about innovation in RFID and tracking of where food goes as well, and thinking about how also in food innovation broadly is, spoilage is a fact that, things are very much in a very produced on time kind of scenario. And so improving long-term storage capabilities of critical foods is also going to be very important beyond just refrigeration.
I would add one more piece. I don't know how short-term this is. So when we talk about this idea of like, what do we do in the short term before we can return back to normal? I don't have a really good prediction at this point of what that timeline looks like, and what maybe more permanent damage to our supply chains might exist. It's not necessarily the kind of thinking we want to do, but I think it's some of the thinking we have to do.
Yeah, great, thank you. One of our students, Kate Toole, has a question actually for you, Professor Katz. She asked a question I think many of us are wondering, which is, what were the major causes of the failure to implement national pandemic plans? Were there weaknesses in their applicability to COVID in particular, or was there just a lack of awareness about plans or communication within governments? Why weren't we better prepared for this, right? Do we not have plans in place?
No, we had a lot of plans in place. And I think, so there's how do you break down that question? There's the question of what does our preparedness and response look like domestically? What does it look like globally? I think, we are seeing different countries respond very differently with different impacts. Sometimes you can't control the virus, right? And we always know the virus, that the microbes are smarter than we are. They always have been, they always will be. And I think that we could have thought about, we always knew also that many of the plans that we had in place, well, any plan you ever make ever is destined to be thrown out, right? That's the nature of plans. But it's the process of having gone through planning and developing preparedness plans that actually make you in a better place. Now, I think, so we have seen these plans work better in some parts of the world. We also knew where the fault lines were. So we actually had an event at Georgetown in January or February, where we talked about if you read those of us who read the fine print in a lot of these contracts and negotiated agreements around global health, knew that there was a force majeure clause in, say, the agreements that for pandemic influenza preparedness. So all of these agreements were actually built on kind of shaky foundations, that in the event of a true global emergency, we knew that we would see nationalization. We knew we would see sovereign expressions of sovereignty over international law. So we always kind of knew those things would happen. We didn't like to talk about them very much because you didn't want to believe that all of your systems would fall apart. But we knew that the pandemic, a true pandemic, would actually stress all of those. Now, what's happening domestically is a completely different situation. And I will say 20 years of pandemic preparedness planning and organization and thinking and structure have literally all been thrown out. So I think we've seen an abdication of responsibility from the federal government and a push to state and locals for things that normally would never have been pushed to state and locals. We've seen a sidelining of the CDC, so the organization that's designed to actually respond for us has been basically taken out of commission as a response. And we've seen the organizations that we had in place at the White House through multiple administrations were gotten rid of. So it's what's happening domestically is I think different leadership and different prioritization within leadership would have led to very different results. But I'm also trying really hard not to focus on what didn't we do yesterday? I figure many of you will be writing dissertations that I'll be reading for the next 10 years on everything that happened in the last 3 months. But at this point, trying to figure out how do we solve, how do we fix, and in some cases, how do we recreate the systems that should have existed from the federal level. So right now, it's like for purchasing power for PPE, you're seeing governors band together and almost it's like recreating federalism. So we're seeing solutions put forward that are very ad hoc, but in some ways trying to recreate the what would have normally been expected from the federal government.
Great, thank you. I want to segue to a follow-on question that Daisy Dunlap has, particularly for Professor Mendenhall, asking about, whether we might see a change in the treatment of syndemic conditions following the outbreak. What changes in the American healthcare system in particular do you think would need to occur in order for people previously infected with COVID-19 to not face the often damning barrier of being listed as having a pre-existing condition, for example, while applying for good healthcare?
Well, that's a great question. So that could go a lot of ways. We could take the political route. On the one hand, when we think about how to care for people as like full humans, we need to actually take away the financial question. So everyone, a lot of you followed universal health coverage. So how does everyone have access to care, and what does that mean, and what does it cost? So one option is a single payer. Another is still closing the gap further on cost, on access issues. There's two big issues. There's the finance, how much you have to pay for it, and how medical care is provided. So it's both the institutional care and the payments. So how do we close that gap for everyone in the United States, and what does that look like? So there's a lot of big political systems issues that need to be cared for and determined. And also, how do we train more doctors and nurses, and how do we pay people a just wage across the system, and how do we strengthen our system and have an actual system? I mean, both the UK and US really delayed their response, but one thing that was pretty incredible to watch as soon as things were changing politically in the UK, a lot of our friends and colleagues, my husband and I spent the time at London School of Hygiene, Tropical Medicine, and as soon as things changed in the UK, everyone left and started working in the National Health Service. And I saw a lot of people around the United States trying to say, how do I volunteer? How do I go? How do I actually go support the response? And there's really, because our system is so fragmented, we don't have that capability. And we need to have a more organized health system that can actually deploy people across the system. We have, 5 different, public systems and so many different privatized health insurance payments, right? That are very disorganized and fragmented, which makes it really difficult. On the other hand, when we care for people as full people, so I've done research all around the world, and one of the biggest challenges in biomedicine is caring for people and not diseases. And this is a very simple way to put it, but many people don't actually get cared for all of their conditions because they have to take a day off of work to go to the clinic to get cared for. On one day, their diabetes, on one day, maybe not their hypertension, but one day their tuberculosis, or one day their asthma or your arthritis. You have to see different clinicians for all of these conditions. So if you have an acute infection, for example, you may be going in for COVID symptoms, but you also are out of your medication for a chronic illness, and you can't get those refilled potentially. They will not be caring for your full health. So when we think about, I talked about how we can change things politically and systems wise, but actually people have written it pretty extensively, but thinking about patient-centered healthcare, patient-centered medical homes. I like to talk a lot about what does actually comprehensive primary healthcare look like? Well, it looks like going in with asthma symptoms and realizing that the symptom or the prescription should have someone call a lawyer to get someone to clean the mold out of your apartment, rather than medicalizing your health condition, which it's not exclusively obviously medical or biologically driven. So many things are socially, economically, and environmentally driven. So really taking that seriously and caring for people as whole people is what's going to be transformative. So is that possible in the United States? I would like to be optimistic. I think we can reimagine anything, but we need to have the political response appropriate to make it happen.
Great, thank you, Emily. I'd now like to ask Eric's question for Professor Stark. He asks that many of the recommendations you propose involve significant increases, of course, in government stimulus spending. Are you concerned about the cumulative effect that this might have on the U.S. national deficit, and when and how is it appropriate to recoup these investments?
If we don't spend during a crisis, when do we spend? I think that in this case, there's been very little concern about the deficit in the past 3 bills. And I can anticipate, as we've seen politically already, for other political reasons, like the fact that he's up for re-election, Senate Majority Leader has been calling that there will be no more stimulus bills. I don't think that probably won't hold. And I think that certainly when you see the president currently pushing, the question about if and how we recoup is more interesting. Obviously, there are a lot of long-term challenges that we're facing as a country and a society that will need to be paid for down the road. And certainly for many of the students on here, it just looks like another trillion, another there, like that's going to be paid for throughout your lifetimes. And that's a big challenge. And I think it's something that no one stopped to start to reflect on. One of the possibilities, of course, was during some of the big bailouts, the major corporations, the possibility of taking warrants or equity stakes in many of the large corporates that were bailed out, like the airline industry, could have been a viable approach. There's a lot of political challenge around that, obviously, but it is something that I think that is worth reconsidering. And it's something we have done before as a country, and it shouldn't feel like it's out of bounds for the US to take ownership stakes in companies, and that could be one viable pathway. But when we're thinking about stimulus that's directly going to the taxpayer, I think it's more difficult. When we're talking about innovation, which can have such large impacts on economic growth, it's really an investment in recovery, which will pay for itself, but not directly. However, some of the more corporate bailouts, it's probably worth the political conversation around it.
Yeah, I think it's a really interesting question. And, if you all remember back just about a decade ago, after the financial crisis, we saw some of the largest investments ever in the clean energy sector in the US and China. And this completely changed, the global competitiveness of these technologies and these countries for the better, right? So I think this is in many ways could be thought of as an opportunity if we do it correctly. I want to turn to a question from Anya Wahal, who talks about the trade-off between all the data that we now have access to and privacy issues. This is a great STIA question. She says there's been a lot of talk that government access to data can help alleviate or control this crisis in the future. Presumably, data could be used to help treat patients, track social distancing, and provide access to resources like water. How do you think the more democratic societies like the US will use technology to alleviate the coronavirus crisis while simultaneously balancing democratic values and presumably privacy issues? Would anyone like to tackle that? Maybe Professor Veeraraghavan?
Yeah, it's this classic conflict between surveillance and privacy and openness, and I think I see, for example, the part in your sentence, the first sentence, right, which I think needs to be. There's been a lot of talk of the government access to data. So if the state has total access to data, you can see it's a problem. But we're talking about access to data that is not just to the state, but also to citizens themselves to kind of question, to understand what's going on. I also want to echo what Professor Johnson talked about, the worry of famine, and I think it's real. And at least in India, there's a lot of people who come out. Amartya Sen, John Rez, and many other economists have come out very strongly in saying that this is really a concern, and goes back to this question of we have a lot of we have very little data about, the government has a lot of data about how much grains are stored in but that data is coming back to this question. Yes, the government has access to the data, but the question, it's not available to us to find out why are so many grains stored there. So we're talking not just about data in its kind of neutral sense of like it's going to be sucked in by the government and used against citizens, but we're talking about how do you democratize access to data so more people actually can talk about in concrete terms, because more, and to change policy. So I think that said, there is going to be a risk in terms of, and you're talking about, the Google, Facebook recent, I mean, I have, I have big reservations about any such technology. I mean, I worked at Microsoft before, so I know the kind of, good, not to kind of completely paint people working in these corporations as not interested. Many of these people, some of my friends are there working, and they're really, really well-meaning. And I think they are trying to kind of figure out, like each of us trying to figure out what can we do. And so you should look at some of these efforts as people trying to do things, but as a whole, I share your skepticism about having so much power to some of these companies to track us. And I think the simple answer is these should not be a black box, and we should have us look into the algorithms, and so we know who's and how that works. Can't just trust and store all of that in company databases. And I think that would be a place to start.
One thing that I'd jump in here quickly, and it goes back to a lot of the framing that I've been thinking about this crisis response, is the fact that, and it goes to the heart of the thinking about long-term debt, is many of the policy preferences that people have gone out the door as we go for immediacy of response for the near term. And I think that even here, as you talk about looking at Apple and Google and trying to put together social distance tracking, it sounds very good as a headline about being able to keep people away from each other for the next few months to a couple of years. But the question about, long-term respecting individual privacy, exactly right. It could be a long-term challenge that many of the things we're doing right now in response is not reflecting many people's policy preferences from before.
Thank you. We just have a few minutes left, so I think I'm going to go ahead and take a great question asked by Theodore Chia, who I think this will be maybe a good question to end on. And he asked it of Dr. Katz, but I want to open it up to everyone. He says, as large exporters like India block exports of general pharmaceuticals and other countries rush to get their needed medical supplies in this crisis, how could countries be coaxed to move towards cooperation when their survival is at stake? And I think this really gets at the crux of sort of the response we're seeing globally. Is this really going to become an opportunity for global cooperation, or is this going to be everyone for themselves, fight for scarce resources? Clearly, there's just so many opportunities for better cooperation here, but as Dr. Katz and others have noted, there's just real failures that we're seeing in the system. Would anyone like to try to jump in on this to wrap us up?
I mean, I can start. I mean, the question gets at the core at, does multilateralism work or not? And I don't know. I think any of us who spent any time looking at international law and international organizations always knew that sovereignty comes first, right? And we're having lots of discussions that feel very Hobbesian these days, but that I don't know how you get around the core of what countries will do in their population's best interest when push comes to shove. I think we can. I mean, the flip on that is that what we also need each other. I mean, we desperately need each other, and this is clearly a global threat that doesn't terribly care about political boundaries, and is impacting people all over the world, which means our solutions are going to have to come from all over the world as well. And so what WHO, for example, is trying to do is push forward this notion of solidarity, that we fight together, that we come up with solutions together, and then we can only get there through deep and sustained collaboration and cooperation. Now, right now there is WHO has an initiative to bring countries of the world together to collaborate and cooperate on the development of medical countermeasures, of a vaccine, and the eventual prioritization, manufacturing, and distribution of said vaccine. And right now, neither the US nor China are party to that. Most every other country is. So, you know, I don't know the answer. I don't know where that gets us, but I think there are clear benefits to collaboration and cooperation and working together against a single threat. We've known that always, but we also know that at the end of the day, countries are going to do what they want to do. And that's yeah. If somebody can answer, you know, do we have a future in multilateralism? That would be great.
Yeah, it's going to be really interesting to see how this all plays out, because I do think that's a big question with implications, not just for the response to this pandemic, but for solving issues from climate change to, you know, many other things. And I'm afraid we're going to have to stop there, but thanks everyone for the great questions. Thank you so much to our panelists for taking time out of their very busy days to really to shed some light on what's happening and talk about how your work is being affected and is also trying to help. I'd like to thank all of the STIA faculty who have been extremely flexible and very creative in bringing all of their courses online and continuing to mentor our students at during this very challenging time. I'd like to thank all of the STIA students and community for your continued engagement and passion during this very difficult time. And particularly our seniors, we are so sorry that we're not able to celebrate you in person, but we really hope you will stay in touch and that we'll get a chance to do that down the road. And we really wish you all the best. Thank you to Abdulio and Patty and the other staff that helped make this event possible. And finally, at this particular time in history, I think it's just more clear now than ever that the knowledge of science and technology are really important to informing important policy decisions and global responses. And I hope that we can all figure out a way to do our part. So thank you all so much for joining this afternoon. This will be posted later online for your friends and colleagues who missed it. Take care, everyone, and please keep in touch. Bye-bye.
Thank you.
Thanks, Joanna.
Thanks, Joanna.